Welcome to Dr. Dental. Today we are talking about your teeth. Your mouth contains 4 completely different types of teeth, each one built for a specific job, shaped by millions of years of evolution and placed exactly where it needs to be. Lose one type, and you don't just lose a tooth, you lose a function. In this video, I'm going to walk you through every tooth in your mouth, what it looks like, what it actually does, and why it matters more than you probably realize. Incisors. Start at the very front. The 8 teeth right in the center of your smile, 4 on top, 4 on the bottom, are your incisors. They're the first teeth you ever grew. Most children cut their first central incisors around 6 months of age, which is why the teething phase tends to start then. Incisors are flat, thin, and chisel-shaped. That shape isn't decorative, it's functional. When you bite into an apple, a sandwich, or anything that requires that first clean cut, incisors are the tools doing it. The word itself comes from the Latin word meaning to cut. They are, in the most literal sense, your cutting teeth. But incisors do something else that's easy to overlook. They work alongside your tongue and lips to produce speech. The sounds made by the letters F, V, TH. Those all require your tongue or lip to interact with your upper incisors. People who lose front teeth often notice changes in how clearly they can form certain words. The connection between teeth and speech is far more direct than most people expect. There are 2 subtypes worth knowing: central incisors, which sit right at the midline of your mouth, and lateral incisors, which sit just beside them. The centrals are wider and more prominent. The laterals are slightly narrower and sit just 1 tooth back from center on each side. Canines. Just outside the incisors, 1 in each corner of your mouth, sit the canines. 4 in total, 2 upper and 2 lower. They're the ones with the single sharp point. You'll also hear them called cuspids, which simply means pointed tooth. Of all your teeth, canines have the longest roots in your mouth. That's not a coincidence. Canines sit at the corners of your dental arch, the structural turning points where your upper and lower teeth meet on each side. That position takes considerable force, and the length of the root helps anchor them securely against it. Their function is tearing. When you bite into something and then pull it apart, meat, bread, anything with resistance, your canines are doing the work. They puncture and separate food in a way that incisors and the flatter back teeth can't replicate as effectively. Canines also play an important role in what dentists call your bite guidance. When your jaw moves side to side, your canines are usually the teeth that guide that movement and protect your back teeth from excessive lateral force. This is why, if you grind your teeth at night, canines often take significant wear over time. They're intercepting pressure that would otherwise damage your molars. Canines are also the last baby teeth to fall out, and the adult canines can be among the last permanent teeth to come through, typically between ages 11 and 13. Premolars. Moving further back, just behind the canines on each side, you find the premolars, 2 on each side of the upper jaw, 2 on each side of the lower. 8 in total. These don't appear in your baby teeth at all. They're exclusively part of your adult dentition, typically emerging between ages 10 and 12. Premolars are transitional teeth. Their shape sits somewhere between the pointed canine in front of them and the broad molar behind them. They have a flatter biting surface than canines, with 2 cusps, which is why they're also called bicuspids, meaning 2 points, and a slightly wider body built for handling solid food. Their job is to begin the grinding process. Where canines tear food into manageable pieces, premolars start breaking those pieces down into something your molars can work with efficiently. They're part of the processing chain, not just a structural gap filler between the front and back of your mouth. Because premolars sit in the middle of the arch, they're also exposed to significant chewing force from multiple directions. They're a common site for cracks, especially in adults who grind at night or who have older, larger fillings that have changed the structural balance of the tooth over time. Molars. The molars are your heaviest duty teeth. Sitting at the back of your mouth on both sides, they have the largest surface area of any tooth, a broad, ridged, biting surface, built for one purpose: crushing and grinding food down fine enough to swallow safely. Most adults have 8 molars before wisdom teeth are considered, a first and second molar on each side of both arches. The first molars are often the first permanent teeth to come in, usually around age 6, which is why they're sometimes called the 6-year molars. The second molars follow a few years later, typically around age 12. The ridged surface of a molar, the hills and valleys you can feel with your tongue, is called the occlusal surface. Those ridges, called cusps, work in close coordination with the corresponding molars on the opposite jaw to break food down through a combination of pressure and slight lateral grinding motion. Your tongue continuously moves food toward the back of your mouth as you chew, and your molars do the final processing before you swallow. Upper and lower molars are structurally different in an important way. Upper molars typically have 3 roots for stability. Lower molars usually have 2. The difference reflects the different forces and angles those teeth experience in each jaw. Because molars do so much heavy work, and because their grooved surfaces are harder to clean thoroughly, they're one of the most common sites for decay in both children and adults. The deep fissures in a molar's biting surface can trap food and bacteria in ways that regular brushing doesn't always reach effectively. Wisdom teeth. Then there are the third molars. Most people know them by another name, wisdom teeth. They sit furthest back, one behind each second molar in each corner of the mouth. 4 in total, though not everyone develops all 4, and some people don't develop any. They're called wisdom teeth simply because of when they arrive. Unlike every other permanent tooth, which comes through during childhood or early adolescence, wisdom teeth typically emerge between the ages of 17 and 25. The problem is that modern human jaws have, over time, become smaller than those of our distant ancestors. The theory, widely accepted in dentistry, is that changes in diet and skull development across thousands of years have left many people without enough room in the jaw to accommodate a third set of molars. The result is that wisdom teeth frequently become impacted, meaning they can't fully emerge. They might be blocked by the second molar in front of them, pushed through at an angle, or remain trapped beneath the gum entirely. When wisdom teeth are healthy, fully erupted, properly aligned, and easy to clean, they function like any other molar. The issue is that this combination of factors is genuinely uncommon. More often, partially erupted wisdom teeth create a cleaning problem that leads to decay or infection over time. An impacted wisdom tooth can also exert pressure on the adjacent molar, potentially causing damage to a tooth that would otherwise be completely healthy. Not every wisdom tooth needs to come out, but every wisdom tooth deserves an assessment, usually with an X-ray that can show what's happening beneath the gum surface before any symptoms develop. Which tooth do you want to know more about? Drop it in the comments. And if this video gave you something useful, subscribe. We publish a new dental explainer every week.